Hi everybody, it's Dr. Cary Yurkiw here. Thank you for joining me today for this webinar on arthritis, stenosis, and chiropractic care. Arthritis is something that we see in the clinic quite often, and today I'm going to talk about how that develops and what we do about it in the clinic. Sometimes arthritis can lead to stenosis, meaning the breakdown of the joints and the bones can start to push in on the spinal canal and where the nerve roots come out, called the foramen. So I'm going to talk about that today. If you're on YouTube Live, you'll be able to see my slides. If you're on Instagram Live, you can always go to YouTube and subscribe to my channel and follow these live videos with the slides on YouTube. I may have the recording available later as well on Facebook and Twitter. So I'm going to talk about neck pain today and arthritis and stenosis and how that develops. And in the clinic, we do see stenosis as a result of arthritis fairly often. And so stenosis is the narrowing of the spinal canal or where the nerve roots come out of the spine and go to various parts of the body. And so stenosis is defined as a closing in of the canal. And there's only so much room for the spinal cord and the nerve roots. So when the canal starts to narrow, it affects the nerve flow going through. In particular, arthritis is one of the major causes, and we see a lot more osteoarthritis in the clinic than other forms like rheumatoid or psoriatic arthritis. Osteoarthritis is a breakdown of the bones and the joints, which leads to material like the disc pushing into the spinal canal or where the nerve root comes out, the foramen, affecting the nerve flow going through. And this can result in a pinched nerve. To treat this, what we do is a history and then an examination. And then what we do is give the patient the diagnosis. Sometimes we do special testing like digital x-rays to determine the condition of the spine. And then we'll talk about treatment plans. Now, a treatment plan may involve chiropractic adjustments, whether they're hands-on, instruments, table adjustments, and then stretches that we give the patient. Now, if they have a pinched nerve, let's say on one side of their neck, we're going to give them stretches initially to the opposite side only, just to open up the space for the nerve so they get relief and the healing process starts. Adjustments will be done to open up that space as well. Allow the nerve flow to get through, the patient to feel better, and to restore the range of motion and the function in the spine. We'll talk to the patient about posture. They may need a special pillow to rest their neck on, or even something like a traction device to prop up the neck to open up the space between the bones to allow the nerve flow to get through. I have a couple images here for you guys. Just going to switch to these images here. So bear with me for a second. And here's some stretches that I like to give my patients. If you look at the ones in the neck and the chest, that's the third column on the right. What you'll see is a stretch where the hands are behind the head, keep the neck straight, chest up, reach the elbows backwards, and then feel the stretch in the front part in the chest going into the neck. This can help with the scalenes, it can help with the pectorals, so that can really help with just relaxing those muscles in the front part. The other stretch that I like to give is side stretches like this. But in a case where there's stenosis, I may only give a stretch to one side versus the other. Here in this picture, this gentleman's stretching to the right side, opening up the spaces on the left side of the neck. And that's going to help with the nerve flow. Similarly, sometimes I'll give neck rotations, and the rotation may only be to one side, depending where the pinched nerve is. As we free the pinched nerve, then I'll add in the opposite side so that the patient can go in both directions, increasing the flexibility and range of motion, especially if they have a condition like osteoarthritis. I will give neck extensions, but I generally don't give this one, the fourth one down, at the start of care. I usually add that in later because it's pretty challenging for the neck to do extensions. The joints, the facets in the back start to glide over each other. It can really irritate the nerves and the tissues. It can sometimes make things worse. So I try not to give that at the beginning, but as the flexibility improves, I will incorporate that into the stretching routine. And then tipping the head forward down to the chest. Most of the time I'll give this one. It's a very good stretch to open up the spaces, especially in the back part of the spine. The only time I don't is if there's some acute disc involvement, which is another topic, maybe a good video topic down the road, but I won't give that for discal injuries, but I will give this for most other conditions. But you should really check with your healthcare professional before you start any new stretch. Make sure that it's appropriate for your condition and get a proper assessment. If you're in the Kelowna area, you can feel free to contact me. I'd be happy to help you. I am accepting new patients, and we do have convenient hours at the Kelowna Clinic. So you can always message me, leave a comment below, subscribe to our channel here on YouTube, our podcast, and also on social media. Please follow me because we'll be doing posts like this on a regular basis. Right now, we've been talking primarily about neck pain. I plan on doing that for the next little bit because it is something I've written about, and this is my book on Amazon, and I published that 3 years ago. And in 2023, I plan on doing a second edition, which will involve stretches like the ones you saw today in the book, and then talking about different conditions like stenosis and arthritis and which stretches are best for those conditions. So if you have any thoughts or comments, I'm all ears. This is a time where I'm doing my research for the second book, improving on the first one. And I look forward to talking to you guys on social media or here on YouTube or through our podcast. And if you're in the Kelowna area, feel free to come to the clinic. I'd be happy to check you and help you with your condition.